So let's break this down. Healthcare runs on data. It drives everything from which drugs are developed and approved, which populations get funding, who gets access to these new products, and how digital health solutions are built. But here's the problem. That data often reflects a narrow view of who we are. Historically, it's been built around whoever was easiest to reach, which was normally white, male, middle class. And when we use that same biased data to build our future systems, we are baking inequality right into the foundations. So now let me ground this in real world examples so it's less theoretical and more tangible. During COVID, we learned that pulse oximeters, those little clips that measure oxygen, well, they can overestimate levels in people with darker skin. That meant some patients were sent home when they should have been in hospital. In another case, a leading AI trained to detect skin cancer used over 100,000 images. Guess how many of those 100,000 images showed dark skin? Just one. So great at spotting cancer on fairer skin, but may miss it completely on others. And now these are just two examples, but we have examples across cardiology, diabetes, dementia, mental health, and the same problem repeats. When your data doesn't see certain people, neither does your care. This isn't just oversight, it's history repeating itself. So why does it keep happening? So let's unpack some of those reasons. We've all heard about Tuskegee, but let's look closer to home here in the UK. You may have heard of the Alderhay organ scandal in the 90s. Where children's organs were kept without consent. It is things like this that shatter public trust. And across Europe, there have been decades of data collection without transparency or inclusion. And today, barriers like language, poverty, digital access, and immigration status still decide who gets counted and who doesn't. And what is the result of all this? The communities most affected by poor health are often the least represented in the data. And this lack of diversity, it doesn't just sit in a spreadsheet, it flows through the entire system. AI tools inherit the same bias. Public health models misjudge local needs, and funding decisions end up reinforcing inequality instead of reducing it. When we talk about evidence-based care, we have to ask whose evidence, whose care. But I don't just want to keep talking about what's wrong. This is fixable, but we have to act with intent. So we need to design for diversity from day one. So bring in those communities that healthcare has ignored for too long. We need to meet people where they are. Go into the community. Don't expect them to come to you. Build that trust through transparency. Let people see how their data makes a difference. Measure diversity as a metric of quality, because a data set that excludes half the population is not accurate. It's actually dangerous. The goal is simple. Make health systems, policies, and technologies that works for everyone. At Unwritten Health, we're building the systems and insights that make health data truly representative, and we can help you do the same. If you're serious about closing the data gap in your organization, whether you're in the NHS, pharma, biotech, academia, or public health, let's talk. Because diverse data isn't just good ethics, it's good science, it's good business, and it's how we build healthcare that finally works for everyone.